So welcome all to the Pride Ortho 2026 mentorship webinar. Thank you for joining us. And just let me know if at any point the screen presentation mode is not correct or you can't hear anything, or your buddy's stuck in the waiting room and needs to be admitted. Um, we are not advancing. We are Pride Ortho, and the agenda for tonight is a quick introduction, followed by talks by four of our fantastic faculty. Dr. Jain is going to talk a little bit about sub-internships, and Dr. Cannada about the residency application process, followed by Dr. Brown speaking about research for networking, and then Dr. Bridges talking about orthopedic conference attendance for networking. We're then going to have two of our resident committee members go over our 2026 to 7 mentoring offerings for the Pride Ortho Mentorship Committee, and then hopefully about 10 minutes for Q&A. Okay. This is the Mentorship Committee, most of whom are present on this call. So if you ever have issues, questions about anything related to the Mentorship Committee or just Pride Ortho in general, feel free to reach out to any member of our committee. And with that, Dr. Jain, you are up. Just say next when you want the slides to advance.
All right. Well, thank you very much. I'm going to be talking about how you can shine with your sub internships. A lot of the stuff that I have to say is going to be very, very common sense, but hopefully it'll kind of hammer in some points, no pun intended, and that you will really, really have a great time as you do your sub-Is. Next, please. All right. So typically your sub-Is are going to be 4 weeks long. This really is your time to shine. Remember, you are auditioning for the program, but the program is actually auditioning for you as well. You want to try and make each day count. I'm going to just go over some pro tips, something about the service work, what kind of questions you should be asking, and kind of how you present a really, really good attitude that's still true to yourself. Next, please. All right, so we're going to go over a timeline before, during, and after. And remember the words of that famous Packers coach, Vince Lombardi? Preparedness is the ultimate confidence builder. Next, please. So before your sub-I starts, do your homework. You really have to know who is going to be your contact person. What's your schedule going to be like? And simple things like, well, where do you show up? Where do you get your lab coat, your ID badge, computer access? Do you have a locker where you can stash your stuff? Map it out. Where are you going to park? How are you going to get there? Do you have to take a trolley, a bus? And if it's an away rotation, you got to get there a day or two early, check out the location, and really make sure you have a decent place to stay. Next, please. And when you're actually on your rotation, there are things that you can do as a medical student, but remember, your sub-I is more than just being a medical student. You're kind of like a mini resident. So, stuff you can do as a medical student, history, physical exam. Yes, you can review charts and labs and imaging studies. You can help formulate a differential diagnosis, help your residents out with discharge summaries. When you're in your outpatient clinic, yes, you do your medical student work, but you know what? You can do medical assistant work as well. I mean, if you see a bunch of patients in the waiting room and the nurses or the medical assistant staff are busy, go get them, open the door, grab the patient and put them in a room. Some of my patients, I do mostly joints. They're older, they have mobility issues. Yeah, they need a hand getting up and around and getting put into a room. You can help out with dressing changes, casts, splints in the operating room. Obviously, you're going to be holding retractors. You might get to do suturing, but help out with anything. Be the glorified gopher, and it is absolutely okay to do that. Believe me, you will shine even doing those tasks. Next, please. All right. So day one, you want to get there early. Please, please don't be late. Just get there early. Just know whom you are reporting to. Introduce yourself. Remember to look people in the eye. It gives confidence. I mean, don't stare at them and freak them out or anything, but really look them in the eye and, introduce you, shake hands, but you kind of got to read the room. If everybody seems like really tense, nervous and stuff, this probably isn't the time to say, "Hey, how you doing? What's your life story?" It's, just get down to business. Just learn to read the room. Next, please. Make sure you go over your schedule with the resident or whomever you're reporting to. And one clue, look for any potential breaks. Know where the restrooms are. You don't want to have to hold it in to take a personal break and then suddenly everything just breaks. So just make sure you kind of know where things are. And always a good idea. Stash some snacks in your pocket, little protein bars. You don't know when your next meal is going to be. Sometimes things are so chaotic in orthopedics, they can be unpredictable. You could be called to a trauma or something. You just don't know. So stash some little finger snacks that you can eat on the way as you're rushing to your next event or something. Next, please. So, when you're in the hospital, a lot of you may have to do some inpatient rounding. Get there a few minutes ahead of the residents. And if it's early morning when you're doing your rounds, as typically we surgeons do, ask the night shift nurses about the patients. Ask them, were there any issues? I mean, we want to get our patients out of hospital as quickly as possible. What's preventing discharge? Pain, mobility, constipation issues, nausea. Do they have any social supports? Ask the nurses, befriend them. They will help you like nobody's business. Next, please. In the operating room, do make sure you know how to scrub. I know it may seem obvious, but I've had some sub-Is that this was their first time ever scrubbing. It's like, that's okay. I'll have to learn somewhere. Most ORs have clinical nurse educators, or ask your resident. When you walk, hi. Hi. When you walk into an operating room, typically there is a whiteboard where they write the name of the patient and stuff. Write your name down and who you are. What is your rank? So the nurse has to enter this into the operative record. And in the middle of the case, I mean, you don't want them to have to take time out to say, "How do you spell your name again? And what are you? What year?" Please, and make sure you introduce yourself to the circulating nurse. That's probably one of the most important people in the operating room. That person like literally controls the flow of everything. Make sure you are polite. Introduce yourself to the scrub technician, anesthesia, whomever. And again, read the room. If they're all like super busy and tense stuff, may not be the best time. And be willing to do any job to help out. Don't lounge. And make sure you don't get scrubbed in until you've actually confirmed with your resident. They may need you to be unscrubbed and go fetch something. So always check. Good communication is always key. Next, please. And how to be helpful in the operating room? Do any job. I remember my attending physician, Dr. Jim Waddell. He was the chairman of orthopedics at the University of Toronto. He was cleaning floors between cases. So if Dr. Waddell can do it, so can I. And I still sometimes help out. Of course, nowadays the nurses don't let me do that, but still, if they are short-staffed, do anything you can. Clean the floor, transport the patient, hold a leg up for prepping, tie up gowns for personnel who are scrubbed. I still do this just so we can get the case going. Help the anesthesiologist with the spinal. I mean, you're not going to do the spinal, but you can help hold the patient. Fetch items. If you don't know where something is, ask. They'll point you in the right direction. So what, you may think, oh, but wait, then I'm not getting FaceTime with the attending. You know what? It's going to be fine because us attendings, we ask the residents and nurses, "Hey, how was this student?" And we'll find out, yeah, this student's really good, good human, helps out everywhere. You will definitely shine. So be super, super helpful. Next, please. All right. When you're in the operating room, remember, wear good shoes. This is not the time to wear your fancy dance shoes. Please wear good shoes with good support. Make sure you hydrate beforehand and you can go to the bathroom beforehand. While you're actually standing up, sometimes for the longer cases, do some stretches, flex your knees and just be aware of the ergonomics in there. I mean, that's a whole separate topic. At AUKUS, American Association of Hip and Knee Surgeons, we've had several talks throughout this. So if anybody wants to contact me about this, I'll be happy to give you some resources and I'll have my email address at the end. Next. So ask your resident what you can do to help. Remember, the residents are there. They have to learn how to operate, and they need you to help them manage the patients who might be in ER or on the floor. And do not consider it an insult or that you're being punished if you have to scrub out and go to the floor to go help get things done. It is not an insult. They are trusting you to do something that's very, very important to them. So definitely do that and communicate with your resident. They'll, and let them know that, hey, I didn't get enough time to scrub in. Could I maybe scrub in on the next one? So again, communicate what you need, but be really helpful. Next, please. How to ask good questions is an important one. You want to be able to ask good questions to show that you're really interested in orthopedic surgery, which that's why you're there. So find your upcoming case list. What are they going to be doing the next day? What you can do at your level as a medical student, you can review the anatomy, know your muscles, the innervation, where are the vascular structures, find out why the patient's having surgery, what are the options for treatment of the condition, and try and correlate the anatomy with what you studied. I do have a good reference book. It's a free book. If anybody wants it, let me know and I'll send it to you. And if you do have time, if you can talk to the patient in the pre-op area, find out about them. It's like, oh, Mrs. Jones, why are you having this total hip? And maybe it'll be that, oh, yeah, I've just retired. I'm going to have a grandkid on the way and I need my hip fixed so that I can help my daughter with her baby or something. It's always interesting just to chat with patients for a few minutes. Again, it's time dependent and your resident may have you doing other tests, but if you can, do so. Next, please. So in the clinic, again, you want to ask good questions. You're doing your history and physical exam. Learn how to do a good ortho exam. And, it'll be body part specific, like anterior drawer test for the knee, impingement sign for the shoulder, Thomas test on the hip, and so forth. Come up with your differential diagnoses. And this is where you can really kind of ask questions when you think about the operative versus non-operative treatments. You can try and understand what's the rationale for all the treatments that we do give. So this is a good opportunity for interaction with your resident and your attending. So this is where you will be able to ask some good questions about how to correlate. Well, here's a real patient. They have a real problem. What are we actually going to do and why are we doing it? Next, please. All right, and attitude. This is pretty much what you learned in kindergarten. I'm not going to tell you anything new. Be yourself. It takes too much energy to be somebody else. And, just like in kindergarten, practice kindness and compassion, be enthusiastic and helpful. No task is beneath you, and communicate. And always be honest. Don't lie. I mean, if someone said, asked you, hey, did you do that? And you actually didn't do it, just say, no, I didn't do it. We will always find out. So don't lie, be honest. And one of the most powerful statements you can ever say is, I don't know. If you truly don't know something, say it. Don't make stuff up. Next, please. And then practice the A's. You might have heard of this, being available, being affable, be accountable. And we always judge people on ability, but it's also about advocacy. So you want to be advocating for the patient. Keep the patient in the center of everything that you do, and you cannot go wrong. Next, please. So feedback, this is one of the things that I do see. We do get a lot of sub-Is rotating, and typically, and you will have a syllabus. Your course director will have spelled out how in the syllabus how feedback is given. Informally, you're going to get it day to day with the residents and attendings, but typically at around the 2-week mark, there is feedback given through a meeting. But if you aren't getting feedback, then ask. Of course, wait for an appropriate time. It's probably not a good idea to ask for feedback if they're in the case and they've just hit the popliteal artery and things are a mess. Not a good time to do that. But the way you can ask, is there something I could do different? Can I do better? Is there any additional reading or research? Do you have any opportunities for me to do extra work? You can even ask the resident, how do I get FaceTime with the attendings? That's the person who's going to be writing your letter. So, a lot of opportunities you can ask, like, for example, when you guys are going from the operating room, maybe going up to round on the floor or in the elevator. So find those opportunities to ask for feedback and, and tell them you do want an honest evaluation. Next, please. Now, what about the feedback in reverse? Remember, you are auditioning the program. Is this going to be a good fit for you? Ask the residents how it really is. Do they have any words of wisdom? Do they like it? But consider your source. If a resident is unhappy for whatever reason, they may offer a very negative view. So what I would do is I would ask a bunch of different people. Don't just have one source. Next, please. So there are a couple of resources that are here. Remember, you all have iPhones or smartphones. You've got a lot of information that is literally present at your fingertips. So use those resources and you will shine to do a quick lookup, but there is no substitute for real studying, sitting down with a book or a computer and saying, okay, I've got to learn the material. But these are some quick resources you can very quickly access. Next, please. So if you have any questions, feel free to email me. Happy to do any coaching and chatting. And remember, you love orthopedics. We want you all to succeed. You will have a good time. Just remember, you will be just fine and be then good luck. Thank you.
All right. Thank you very much, Dr. Jain. And up next is Dr. Cannada.
Hi, I'm so happy to be here tonight and talk to you about strategies for a match. So, next slide. Let's just talk about the numbers. Anyone going into orthopedics has to know the numbers. It's the most competitive, especially, surgical. Dermatology still was a little tougher this year, believe it or not. Um, for this year, there were 1,652 applicants for 963 positions. There were 32% of unmatched of senior MD graduates that did not match. So it's important to understand the numbers and play the numbers to your advantage. Next. And strategic timeline isn't to start in your MS3 year. You need to start earlier. And again, all my slides I will gladly share with anybody. Put a lot of information to be helpful to you. But I provide suggestions for everybody. But right now, this is a time we're concentrating on the MS4s that are beginning their application. So at this point in time, I know today I just got another personal statement to review. You should be lining up your letters of recommendation. The ERS deadline is September 15th, and you need to signal realistically based on the numbers I showed you. Next. So let's talk about how we can make this successful. Everyone thinks research is everything you need. And research definitely differentiates competitive applicants. One thing I'm going to say, one of the most important articles was an article in Curious 2 years ago. Melvin Harrington from Baylor was one of the authors. They looked at all of the applicants who were PGY3s at the time and looked back to see how many publications they really had. And guess what? 150 of the 650 applicants that they looked up had no publications. So everyone thinks research is the end all do all, and for some programs it is. And I'm going to talk a little bit how things have changed this year. Definitely first author publications is very strong. Competitive applicants based on everyone nowadays is just having a poster or oral presentation. Minimally acceptable is to submit a manuscript or a thesis that got completed. Insufficient is something that you can't really talk about. And the relationships that you develop with the research really matter too. Next slide. What I want to talk about for the MS4s is what is new. The ERS scholarly work section, that is different this year. The publications section from previously is now called scholarly work. You can only put in there peer-reviewed outputs. That means it's an article. They do include book chapters and they do include published abstracts. That's all that you can put in there. You can't put the 10 projects you're working on that you haven't done anything to finish. So that's why it's really important to keep that in mind. And you can group your related work into scholarly collections to show a specific curation focus. And there's going to be applicants that have that. No matter what your entries are, each entry should explain the work, its significance, and your role in it. So this is new for this year. So as all of us are helping our mentees, it's important. And as our mentees, you need to start working on this. Next. Also, we're having this webinar because there's people with underrepresented minorities, and that includes members of Pride Ortho, JRGOS, AALOS, RJOS, and the AAOS diversity initiatives help. And they provide rotation information on rotation activities, conference access, and this is supportive and professional. There's also, we can talk about women in orthopedics representing more and more of applicants as it goes. Uh, and it's significantly increased. And that's because when you see one, you know you can be one. DO applicants have a much more difficult time. Many ACGME accredited programs now do accept them, but the match rates are under 50%. This year it was 42%. Very important to realize that. And then there are people going in from non-traditional backgrounds. And what you want to do in your application to make it count is your strategies for matching. Very important. So next, who writes them? So I'm talking about your application and strategies to match. You need 3 to 4 letters of recommendation for orthopedics. The chair letter is not required anymore because many times it would say the same thing about 10 people from the same program. It's not required. That came out from the AOA and CORD initiative. And every year, CORD comes out, the Council of Orthopedic Residency Directors comes out with recommendations. And last year was the first year that the chair letter wasn't required. And you always want to have one external letter. And why do you want the outside letter? The outside letter is so valuable to show the same characteristics described by others. They're supporting that what everyone else said is true. So it validates your whole application with those strong letters from an outside program. Next. So let's talk about your personal statement. I must have put my graphic isn't showing up. There, the personal statement. So I have a graphic there. Apparently didn't show up when I sent it. But the personal statement, let's talk about how to make it. I always say the personal statement's like a bell curve. Very few people are going to be at the top of the bell curve with such a compelling story. You surely don't want to be at the bottom, but you should use the opening hook to orient the reader to your story. And then how you fit into orthopedics. You can reference research, leadership, and or teamwork examples. You can't put all of that in there. It's a single page. But how did you know you fit into orthopedics and why you fit? And you want to talk about authentic motivation to be in orthopedics. There are definite cliches to avoid. Some of the words, unless you're an avid woodworker, stop talking about woodworking, stop talking about improving functionality. If I hear that word one more time, I'm going to pull my hair out. And, everyone talks about tearing their ACL and that being why they did it. Make it different than the traditional story. Avoid cliches. And every sentence counts. And one thing I say in this competitive landscape, I do include, you can upload your personal statements separately. Maybe your top 5 or so, you want to have a program specific theme at the end of your personal statement. When 700 people don't match every year, we have to have strategy. And that's one of the strategies I employ with my mentees. Next. Away rotations, uh, how do you pick them? This is part of your strategies for a match. And I call away rotations, we call them the AI, but really it's audition with intention. Okay, your intention is to match. Your homework should start early. In your first or second year of medical school, you find out where everyone from your medical school matched the past 5 years. Start looking at those programs because that's a good choice. And then let's talk about your class. If you have 15 people in your class going into orthopedics, you better not all show up at the same place to do your rotation because you're going to knock the other people out. There is enough programs, over 212 programs to be exact, that you can pick and go away so that you aren't overlapping. and be realistic. Unless you are at the top of your class and your score is 260 or above, you really can't apply for a REACH program. You can't. You can't go way to there. You have to think about what is attainable and what is appropriate. And I'll be happy to define that and help you in that. And you want to explore outside your comfort zone. Don't do all three in the same place. I always say divide the country into thirds, either, West, Midwest, and East, or, top, middle, and bottom. Don't go to all three in the same third. Explore outside your comfort and you will grow. And rankings matter. One thing you can't change is the medical school you go to. And there are many people might be from orphan medical schools. The rankings really matter in the match. There's a lot of reference. Next slide, please. Here I was trying to advance it. Next, this is an article that was published last year in JBJS, and really it does matter where you go. That comes into play. We had one of the most brilliant statisticians I ever worked with that proved it in this article. Next. Yeah, okay, exactly. So I do have graphics, but they disappeared. This is just talking about what Dr. Jain talked about. I'm not going to, yeah, my graphics disappeared when I sent them to you, Dr. Fram, but that's
I'm
okay.
sorry.
That's okay. Be prepared, demonstrate more than eagerness. Have an intellectual curiosity and a due diligence with your work ethic. Always be collegial and collaborative. The tortoise versus the hare. This is the lesson I give to everybody. Who wins? The tortoise wins. Don't jump on the first day and jump to ahead and, really step on others that way. And use feedback and act on it. And don't ever let me see that phone in the OR when you're on your AI. Next. So, Iris, I'm talking about building a successful chance for a match. Your transcript includes step one, you want to make sure you take step two so it can be included. Right now I'm working on everyone's three statements for their MSPE. They're all submitting it. I mean, now when we mentor, I am mentoring everyone through every step of the process. Clerkship evaluations are read carefully. So specific language is what everyone's paying attention to. Extracurricular and leadership. Everything got changed when you could list 10 experiences, 10 experiences, and you can talk about three being meaningful. The biggest thing is your three meaningful experiences can't come from the same category. You can't have all volunteerism or advocacy or research as your top three. You have to have, you divide your 10, you give them a category, and you don't want your top three all from the same category. That's another tip for success. Next slide. And signals. The rules are you must signal your home program and all the AIs that you go to. They will tell you if they don't want it. Most programs require signals. Amazingly, that actually comes from the GME office, and there are some programs that don't require a signal. Find those that don't. Look on social media and make sure you signal you apply to those, and because you don't need to waste a signal. And remember to be realistic, reach, attainable, and appropriate. No more than three of your signals should be reached based on the percentages of the match that I showed you. And lastly, next slide, final slide. Oh, the graphic didn't show up either. The art of mentoring. Make sure you have a good mentor. It did. No applicant is going to succeed in isolation. Mentorship is not an advantage. It is needed. The applicants that don't match, and many people reach out to me after they haven't matched, I can definitely tell because they didn't have someone mentoring them, went to the wrong ways, or, didn't have the right advice in even their application. And I want to wish everyone good luck, and I hope I gave you some good tips for success. Feel free, next slide, to reach out anytime to me. And my Gmail is in there, my graphic. Again, it's cannada.lisa@gmail.com. And don't forget, your family backs you up and supports you. And I'm part of your family to help you.
Sorry about the graphics. Thank you very much, Dr. Cannada. And next up is Dr. Brown.
Thank you, everybody. I'm going to be brief because research isn't as important as you've heard from our first two speakers. Next slide. Okay, and yeah. So the diversity that we lack in orthopedics also applies to academics. MD PhDs were the second lowest with 0.9%. If you have an MD PhD, next slide, your biggest risk is you're going to be called a nerd. So I don't try and claim I'm like the other minorities that are underrepresented. But anyway, if you have an MD PhD, you probably don't need to listen to this talk. Next slide, please. I think what's important to think about research is what do residents look for in applicants? They look for dependability. They want to find someone that's easy to get along with. They want someone that's hardworking. They want someone that's excited about their program. I've added a couple. Someone they want to be on call with. Someone that they want to spend the next 5 years with. None of those have anything to do with research. Next slide, please. So there's a nice video put out by AAMC debunking the research arms race, navigating publications in medical school. I think the change in your research academic output in the new in this cycle is a good change, so that you're not trying to pad it. And that's one of the things they found, is that people will have an abstract and a poster and maybe a paper all on the same project, and they want to claim 3 different things. And so I think the key is that you find one project that you are interested in, that you put a lot of effort in, that you can discuss intelligently and be excited about. So next slide. And so this was just a recent publication this year. What's important? First things first in medical student research. Find something you care about. You need to put time in it to have some reasonable output. And so if you're not really interested in it, it's going to show. So find something you care about. Curiosity over productivity. You need one project, quite frankly. Something that you can discuss. And so find it enjoyable. The biggest thing that we've talked in the previous presenters is this is about mentorship. Pick someone that you want to get to know, but also someone that you can get to know. One of the medical students I work with picks the chairman of the department because he was interested in his research. Well, that's great, but do you think you're going to get a lot of face time with that person? They're going to get to know you and write you a letter. That might be a bit of a stretch. So you're often better off finding someone who's a younger faculty member, who's a little hungrier, who may have some time to work more and get to know face-to-face more time together. So it's really about building a relationship with that research mentor. And then what I always ask for any research question, and what you're going to be asked at interviews, is how does this research project going to change clinical practice? Because that's the bottom line. The small percentage of residents are going to go into academic programs and be expected to do research. Most people are going to go into private practice. They'll never do research again. They never want to do research again. It's about getting an interview, being able to discuss a research project intelligently, and but showing all the other things that you need to show on your sub-I and in your application. And next slide. And this goes back to what actually helps you match. You need to do, the most medical students matched based on their away rotation. some of them for the home program. A very small percentage, 6 out of the 91 in this study, was research exposure. And those are people that did a research year. So it's not really what you're looking at here as first-time applicants likely. So a few geographic ties, some no exposure and no away rotation. But again, research really isn't part of this. It's about doing away rotation or your home program rotation, doing well, showing that, the residents and the faculty that they want to work with you and they'd love to have you. And that's what it's about. So research is just going to get you through the interview, hopefully get you an interview that you can discuss, but it's not going to be what matches you. I think that's it.
Cool. Thank you very much, Dr. Brown. And up in next is Dr. Bridges.
All right. So good evening, everyone, and happy Pride. So I'm Carla Bridges. I'm a pediatric ortho sports surgeon at Dayton Children's Hospital, and I'm covering networking with intention. All right. So next slide. Is it? Oh, sorry. At first, it wasn't shifting. There it goes. All right. So I'm sure many of us here have attended conferences where we've had met a lot of new people. We collected a stacks of business cards. We connected via social media, and then never spoke to those people again. And that's one of the mistakes that many can make when they're networking at conferences. They make it more transactional instead of relational. So networking isn't really about meeting the most people at an event. It's about building the right relationships. So meaningful relationships within a professional community that supports your career and your authentic self. So you want to think of networking as community building. Next slide. So people can tell when you're only approaching them because you want something. And so the best networking happens when you're genuinely curious. So in a transactional mindset, you might be thinking, what can this person do for me? And may approach them with a question like, can you help me get a fellowship? The result may be a very bland and generic response because that person is probably thinking, well, how can I help you get a fellowship when I don't really know who you are? Like, I barely know you. So this leads to forgettable conversations when people sense you only want something. Instead, try a more relational mindset where the internal question may be, what can I learn from this person? Or how can we support each other? And you may want to say to them something like, I'd love to hear about your career path and what you've learned along the way. The results here are usually more memorable because this conversation is driven by genuine curiosity, creating an authentic conversation that can build lasting ties. Next slide. Okay, so where to start? You should know your purpose before you arrive. Many attendees show up hoping opportunities will just magically happen. Instead, pick 2 to 3 specific goals before every conference to focus your limited time on. So before the meeting, ask yourself, what am I looking for? So some examples may be a research collaborator, fellowship advice, mentor, job opportunities, sports coverage opportunities, leadership opportunities, LGBTQ plus community, or friends who understand your experiences. So let's say you're attending AAOS, you can approach it like, I'm going to go there and just see what happens. Or you can set a specific goal like, while I'm there, I'm going to meet 3 ped sports surgeons. Instead of hoping to run into people like you, set a goal to introduce yourself to the Pride Ortho leadership team. Instead of thinking you should say hi to old friends, commit to specifically reconnecting with 2 of your former mentors. So that's really intentional networking. Next slide. So conferences, they can definitely feel overwhelming. And while attending conferences, one way to help with that is using affinity groups intentionally as well. So an affinity group is a community of individuals who share a common identity, background, or lived experience and come together to provide support, mentorship, networking, and professional development opportunities. So examples are like Pride Ortho, Gladden Society, Ruth Jackson, etc. So one of the greatest advantages of organizations like Pride Ortho is that they create spaces where people don't have to choose between professional growth and authenticity. They provide community, mentorship, sponsorship, psychological safety, professional opportunities, and much more. So I want to encourage all of you to attend Pride Ortho events, introduce yourselves to leadership, volunteer for committees, join social gatherings. And the key message here is that visibility creates opportunity, and people cannot advocate for you if they don't know who you are. Next slide. Something else you should also have ready to go is your 30-second elevator pitch. because when someone asks, tell me about yourself, you shouldn't have to improvise. So networking isn't about being naturally outgoing, it's about being prepared. So why does this 30-second pitch matter? A strong elevator pitch helps people remember who you are, what stage of training you're in, your interests, and how they might help you. So, a formula you can go by: start with your name, followed by your current role, followed by interest and your goal. So, an example would be: Hi, I'm Alex Smith, third-year medical student at Ohio State, interested in orthopedic sports medicine. I'm currently working on ACL outcomes research, and I'm hoping to connect with surgeons who are involved in resident education and mentorship. And this should then lead to a transition question. So ending with the question prevents the conversation from ending awkwardly. So you can ask something like, how did you become interested in sports medicine? Or what advice would you give someone interested in your career path? Next slide. So this is how your pitch may look depending on what stage you're in your career. So medical student's goal may be hoping to connect with surgeons involved in residency, education, or mentorship. A resident's goal may be learning about fellowship training and building relationships with mentors. A fellow's goal might be job opportunities that are out there after their training. And an early career surgeon's goal may be to continue connecting with colleagues who share passion for the same specialty or personal interests. Next slide. So you've met some folks, you delivered your pitch, but that's just the beginning. Follow-up is where networking actually happens. Most networking fails because there's no follow-up. I encourage you all to take advantage within 1 week. Take action within 1 week. Send a personalized message referencing a specific detail. So an example: it was great meeting you at the Pride Ortho reception. I enjoyed hearing about your experience building a sports practice. I'd love to stay connected. You can connect via LinkedIn or other social media accounts. And the proof that you truly want to build a meaningful professional relationship is when you follow through immediately on any offered advice. So, for example, if someone suggests making an introduction or ask if you'd like to assist on a manuscript or a research opportunity, you want to respond promptly because reliability builds reputation. Next slide. You also want to be a contributor, not just an attendee. So one of the fastest ways to build a network is to contribute. So examples would be presenting research, moderating a panel, volunteering, serving on a committee, help organizing events, mentoring students, etc. So people remember contributors and recognize your work and your work ethic. When you build visibility, it generates opportunities as it naturally attracts collaborators and sponsors. And then strengthens the network and you build a reputation as a reliable pillar of the community. You don't have to be the most famous person in the room. You just simply need to be someone others enjoy working with. Next slide. So here's the checklist. So before the conference, know your goals. During the conference, focus on authentic relationships. Confidently introduce yourself using the 30-second pitch. Offer help or express genuine curiosity before asking for help. After the conference, follow up consistently, stay engaged, and look for ways to contribute long term. And finally, your network should not just advance your career, it should also support who you are as a person. The most meaningful professional relationships are the ones where you can show up authentically, be supported, and help others do the same. Thanks.
Thank you very much, Dr. Bridges. And now Alex and Cameron, I believe, are taking it away.
Yep. So I'm going to talk a little bit about the mentorship program for this upcoming year. So the mentorship community will continue offering one-on-one mentoring for students this year. Residents and fellows, as well as professional researchers in orthopedics, are welcome to apply to be mentors as well. You can apply to be both a mentor and a mentee. We also have mid and senior career mentor volunteers in case more junior attendings are interested in having a mentor assigned. And the match will be biannual. So the next match will be planned about 2 weeks from now for those who apply after this webinar. We are also going to continue our residency application cycle focused offerings of ERS application, personal statement review, and mock interviews. The mock interviews were new last year and they were pretty well received. And so we'll be using feedback from that first time around to make some changes for this year. Can we go to the next slide, please? And so for the mentoring program. This is a structure to be a one-year commitment, although ideally these relationships will last you much longer than that. The mentee should decide what they like to discuss during these meetings and should initiate the scheduling of the meetings. And so we'd recommend a meeting at least 2 to 3 times a year, and we'll suggest a framework for this towards the end over here. We can go to the next slide. So in order to sign up to be a mentee, you can log into the website and then click on the mentorship tab on the top. And it's important you sign in first, otherwise that tab won't pop up. And then once you click on, you can scroll down and then click on the mentee application. And then if we go to the next slide, we have QR codes as well to sign up if you would like a little shortcut here. And then if we go to the next slide, the questionnaire itself is pretty streamlined. We try to keep it pretty brief this year. Should take 5 minutes at most. We ask about some background demographic information as well as your priorities in terms of being matched with a mentor. And a couple of important notes. If we go to the next slide, there is a requirement for confidentiality between the mentor and the mentee. If this is violated, it is grounds for removal from the program. In instances where a mentor doesn't feel qualified or capable of counseling a mentee on a subject, if both the mentor and the mentee agree, then the mentor can connect to the mentee with someone else in their network who you think may be better suited. And if you can go to the last slide. So this is a framework for structuring your mentoring meetings. So we recommend that you think about your present situation, desired outcomes, options for achieving them, and then coming up with a plan yourself. You can expect the mentors to listen and ask questions. They may provide a combination of advice based on their experiences or those of others, or take the approach of coaching, asking a series of questions to help you figure out how you'd like to proceed. In my own personal experience, I found that I had the most success in building a successful mentor-mentee relationship when I came to our meetings prepared. And then I asked my mentor to help think things through with me rather than just asking questions for which I expected them to have answers. And that is about it.
Okay. Thank you so much to all. Do any participants have any questions? If so, I think you can just pipe in or type them in the chat. If you don't, then we will maybe chat amongst ourselves a little bit. So Alex, I think that last point that you were making is a little bit the difference between a mentor who's actively mentoring you and someone who's coaching you. I don't know if you've ever heard that differentiation before. The idea that when you're in coaching mode, you're kind of leading someone through their own thought process. So say you are a third-year med student going into fourth year and you say to me, I want to figure out where to do my away rotations. What do you think? I'd say, well, what's important to you about a program? What are the top 3 characteristics that you're looking for in a residency? And I would sort of lead you along your own thoughts to help you come to your conclusions, which are not necessarily the same as mine. So coaching. All right, Lisa.
Yeah, I want to point out to everyone, this year is a tough year. There are several students that have applied for AWAYs and haven't gotten them. I have people, even another person reached out today, they got one away and had applied for 8. So it's really important to work with mentors and be realistic, as I said. And also, it really helps if you have your scores ahead of time. Some schools don't. And some people that are at disadvantage, I'm just going to tell you in the process and why you might have to work harder is the if your medical school is only pass fail, sometimes that's harder in this application process, even for the away rotations. And it's really important to ask for help and advocate and be realistic, and not everyone can go to the biggest and best programs.
If I could make a quick comment.
Yes, please.
I love Dr. Jane's comment about I don't know. What I learned from Nth Dimensions is I don't know yet, which implies you're going to go look it up and find the answer. And when you get the answer, don't run back and tell them, wait for them to ask. They'll remember, they'll ask the question, but have them ask it and be ready. Don't just blurt it out when you figure it out.
That's a great point. Great point. I'm going to go change my slide if I ever do a future presentation. I'm going to say, I don't know yet.
That's great.
I know one student when she was on one of her away rotations. She's an attending now, but she didn't know the answer to a question. She said that was her response. I don't know yet. She actually typed out like not a whole paper, but like typed out the answer and put it in an envelope and slipped it under the attending's door after hours so the attending could see it the next morning when she walked into her office. So.
Is that Dr. Chambers?
No, that was Robertson, Alicia Robertson.
Okay.
Or now, oh gosh, I'm blanking on her married name now, but yeah, it was Alicia.
That's awesome.
Yeah.
So cool. Anybody else? Yeah, I'll just make one more plug then for the programming. You get assigned a mentor if you sign up for a program. And that's a point person for you if they don't have information or experiences that you want access to. I know within the last 3 months, I've had to sort of pull another contact and put one of my mentees in touch with that person to get them the answers that they were looking for. But think of that person like a gateway for you a little bit. Yeah. And then mock interviews. We're doing them again this year. Same with ERAS and CV review. So those links should be live right now, actually. But once we get the date picked for mock interviews, I think those were very well received last year. It's 2 hours. It'll be on a Saturday or a Sunday. And we will give you an opportunity to practice interviewing with, attendings and feel those nerves for the first time in a setting that doesn't count.
I have a quick question about the mock interviews. Is that something that you would just recommend that M4s do or M3s as well?
Yeah, I mean, I think honestly, we have the questions structured for sort of residency process. There's no reason you couldn't do it as a three. I feel that things are creeping earlier and earlier. And as long as, you're willing to spend the 2 hours, we'll find enough personnel to staff it for you.
Yeah, I would throw in the caveat as long as it's not oversubscribed.
Cool. Well, thank you all very much. And I guess I'm the person who says the thing now, where we're giving you 3 minutes of your evening back. So thanks all. Have a good night.
Thank you for having
Have a
this.
good night.
Everybody.
Right.
Good night, everyone.
Good night.